Doctor strike in South Korea has entered its second week. As hospitals are struggling to treat patients, the health ministry has granted new powers to nurses. Nurses can now perform medical procedures which are normally conducted by doctors in the country. Nurses have complained about the legal risk and heavier workload after over 9,000 doctors staged a walkout from their jobs. The protest has forced hospitals to turn away patients and cancel procedures.
It is expected that PA nurses will be legally protected even if they are sued or accused, because the legal basis can be clearly explained.
South Korean President Yoon has vowed to go ahead with his plans to increase the number of students admitted into medical schools. The government says that the enrollment plan will add up to 10,000 doctors by 2035 and that this move will help South Korea cope with its fast-aging population and plunging fertility rate. Officials say that South Korea has 2.1 physicians per 1,000 people, which is far below the average of 3.7 in the developed countries.
어린이와 노인, 장애인을 비롯한
Protecting people such as children, the elderly and people with disabilities is directly linked to the government's core policy on welfare for the vulnerable populations in healthcare. Therefore, this medical reform is not a matter for negotiation or compromise.
More than two-thirds of South Korean doctors are currently on strike. Doctors on strike claim that schools in the country cannot handle an increased number of medical students. They predict that doctors facing pressure from increased competition will over-treat patients. This in turn will increase public medical expenses.